Again, here's Vince at the studio and Dr. Patino in his office to discuss mental health issues and some of the issues of the day. Hopefully, you're listening live. Please feel free to make comments, and we'll respond as we can. Um, Dr. Patino, how are you doing today?
It's been a long day. I just finished seeing my last patient, which is always pleasurable to see patients. But I'm trying to get myself back into the routine of seeing patients in the office. For a year and a half, we've been doing a lot of telemedicine. We're starting to get back into day to day. So that is kind of a retraining for me, even though I've been doing this for more than 30 years, get back into the personal connection, which I think is terribly important in this business. And is something that sometimes is a little difficult to do in telemedicine. But we're getting there. I mean, I really enjoy being in the office talking to some of these patients. Um, some of them are very difficult. So and it's not an issue of joy, it's an issue of trying to find ways to provide him some options, in terms of how to manage their suffering.
And those are the things you've always talked about. Your job is to be a guide to them, give them options. Um, and to that point, what we're going to discuss today is something that's been in the news a bit lately with an example of Simone Biles, the most decorated gymnast, I think, in history. Actually, she's tied with a Russian woman, and I think she's the most decorated American gymnast um, ever, uh, having basically stepped away from her Olympic glory because of stress.
Correct. And it's really fascinating because Simone Biles has actually done a lot of speaking herself about performance anxiety and
Hmm.
teaching younger athletes in terms of how to manage performance anxiety. And she finds herself in a situation where she feels very stressed, in that, I mean, she puts it as my brain and my body are not connecting with each other, right?
I think she actually there's a specific thing they called it the twisties, and that
Exactly.
evidently is their inability or the inability to find yourself in space, 3D space. And said she was having trouble doing that and was worried about actually injuring herself.
Exactly. And we need to understand that what these athletes do is dangerous. I mean, this is not like run of the mill playing in the backyard stuff, right? I mean, these people are, I mean, just twisting in the air and doing somersaults and all kinds of different things that are pretty dangerous. So their brain and their body has to be in total synchrony. But the question is, okay, so why the twisties, right? Why do they get this type of emotion? I think that if we really think about it, we all have experienced it, right? Is that like gut feeling you have that you're feeling nervous or afraid and you're trying to write your name and if it doesn't come out right,
Mm.
right? Like when you're getting married and have to sign the certificate,
I remember that.
you
I did
remember
that
that.
twice.
So if you look at your signatures, did I really sign that way? Because these are special circumstances, and it's not always fear. It can be any kind of excitement or anxiety because situations that move you away from your level of comfort or calmness have an impact on your brain, biologically speaking, right? So for these athletes, when they get um, into doing their best performances, they're totally unafraid. They're totally like in a space in their minds where it's almost like a meditation state, right?
The zone, right? Is
The
what we call
zone. So if you were to like check their heart rate and their sweating and all that stuff during those moments, you're going to see a total level of calmness. Anything that impacts that, getting them out of the zone, increases the risk of making mistakes. So why do they make mistakes? Because you're going to into basically some degree of a fear fight and flight reaction, right? So when you find yourself afraid, right, um, your heart starts pumping harder. You're still getting a lot of your stress hormones, norepinephrine, epinephrine, dopamine, cortisol elevated, right? That's going to have an impact because your body moves down to a point that your learned behaviors are not as important as your survival, right?
it.
So your survival becomes the guiding principle for your body. Not your performance, not the calming effect of doing a routine that you have done 20,000 times. But now you're moving into a survival state. And when you move into that survival state, you're not totally in control of your reactions physically. And that is because your body is kind of like in a hyper alert state, ready to run.
Mm,
So if you are a professional athlete and you get into that, you get outside of your zone into a fear type of reaction, doesn't matter how intense it is, you're not going to be able to perform. The second thing that happens is that psychologically speaking, you get into a situation of self doubt, right? So if you have a combination of um, irrational fear, right? Because it's not rational. They're not, I mean, if they think about it, I've done this many times. I've done it many times right. But the fact that I have this doubt and it's giving me some degree of fear is creating a biological process that keeps me from being able to perform, right? And every athlete kind of knows that. Sometimes the athletes feel pressured into doing it, you know? And I think the fact that Simone Biles is Simone Biles, she could do it. She could say, I'm not going to do this. I mean, it worries me because there's some athletes that cannot say that,
yes.
right? That they feel that they're letting people down. That they feel that they are going to lose something, that they have something to prove, right? But I think that Simone Biles was extremely brave and extremely dedicated to herself, which is not selfishness, is self empathy, to say, I don't need that because the most valuable thing I have is me, not my career, not my artistic talent or my gymnastic talent. She has none of those things if she doesn't have herself. So the fact that she thought of herself first should be applauded, right?
I agree, and if you look at her background, and she did not have the easiest background growing up. Was in foster care. Was partially raised by I think her grandparents. Was diagnosed with ADHD. Of course, the sexual assault and sexual abuse allegations or experiences. This is not an easy life, and neither is the life of a professional athlete, especially in a sport as physically and mentally demanding as gymnastics. So this is not some milk toast, you know, couch potato person making a decision of this. This is a high level elite athlete. And it reminds me of some of the stories I've heard from the people in the special operations community, especially at the tier one levels, where they used to do what they called an SOB, a shrink on board. And it was literally a psychologist or someone who understood the performance levels and psychology and psychiatric issues, I guess, as well, would literally be on the plane with these guys before they jump out of 30,000 feet or out of a helicopter, what it is, and would judge them and would actually yank a guy off mission right before they got out if they thought they saw that doubt, if they saw that some type of thing that said, you know what, they're getting their version of the twisties and they're going to either jeopardize themselves, the other men, or the mission. So it's not just in athletics.
Yeah, absolutely. And I mean, obviously, Simone Biles has never been my patient, so I don't have any intimate psychiatric detail about her life. I mean, beyond what is known. But I can tell you that if you look at the process and the behavior, right, and it's very easy to think of somebody like her as having had terrible life, of having had traumatic experiences. But I think that what we've seen from her decision making, especially most recently, is that she's definitely a survivor, right? She survived a lot of stuff. And in order to survive, you have to have a lot of strength, you have to have a lot of self discipline, you have to have a lot of growth that she has had at her young age. So the decision she made, I believe, I mean, looking at it contextually from the outside, I think that her decision was an extremely mature decision. Now, I wish I could say that the decisions that were made by those critics of her with their knee jerk reactions was mature too, but it was terribly childish. I mean, it was like dishonest. Those reactions of criticism and rejection and self patriotism. How can you betray the country by doing this? You know, I think that's childish. That's what I would expect from a 6, 7 year old in first or second grade, right? But it also worries me too that you have a knee jerk reaction from the other side on people that are offended by the comments and feel that they have to protect her. Okay. And it is something that I've seen in her, even after, because I've followed the gymnastics on TV, even after her decision and her decision to do the vault, I think it was yesterday or this morning, something like that. Very self sufficient, very self control. She's in charge. So it doesn't really matter, what the critics say. It doesn't really matter that there's a need for somebody to defend her. I mean, her persona by itself is her own defense. She doesn't need people trying to justify what she did. She doesn't need to justify that to anybody.
Hmm.
Nobody.
Question though for you, I'm with you on the criticisms, or it's amazing because having, like, worked with professional athletes myself, you've worked and know professional athletes, the level of discipline and dedication and commitment and just the entire lifestyle, just being absorbed in their sport to push themselves to levels that most normal people wouldn't even can't even conceive of. That people who are normal, who can't conceive of those things and don't understand it, don't have context, are so critical of a decision like that. Why is it the people that seem to do the least are the most critical?
Well, I'm not going to speak about anybody in particular, but in general, you can say that people who get critical of somebody's self sufficiency and self decision making and matureness is basically showing their immaturity,
Mm,
right? Their insecurity, right? I mean, it is like they're questioning their own self and manifesting self doubt, okay, by trying to live somebody else's decision or to put themselves in somebody else's shoes without any empathy. So I think that this whole issue of the criticism, Vince, I think is more of a reflection of today's society than necessarily a contextual issue. I think that this is one of those things that require a lot of introspection and requires a lot of context, right? So we talked about this in the last couple of programs, which is this idea that people nowadays is looking at photographs and making a judgment of the photograph, good, bad, ugly, pretty, and none of those photographs had any context. So think of it as them seeing the news, right? Simone Biles decided not to compete in the all around gymnastics. That's a picture, right? And then automatically they're making a judgment of it.
mm,
And in my business, I can't afford to do that. I have to take a step back and said, okay, so what is the context? What does it mean, right? Um, and take it away from trying to direct somebody else's choices by shaming them, right? Because at the end of the day, what is the purpose of the criticism?
yeah, what are they going to benefit out of it at all?
Yeah, I mean, how are you helping her grow further? I don't think she needs much more growth. Okay, I think that the whole process shows her growth. Okay, and her survival skills. So anything that these people are saying is totally senseless and purposeless. And I was thinking that before the program, I was thinking about, okay, so if this is a reflection of how society judges pictures nowadays, you know, and the more judgments you make, the more proud you are of yourself. How can they get away from that? right? How can we help people not get into the judging business? And I think that what I would suggest to a lot of these people who are in the judging business is to sit down themselves and look at pictures of themselves and make judgments of them, right? Or put yourself in front of a mirror and start saying, you are this, you are that, you know? Maybe by recognizing that a lot of what you're doing by judging other people is projecting yourself into others. Okay. You may understand that you stand a chance to develop some empathy. Now, there's a more sinister part of this, which is making money out of the criticism, right?
Mm.
I mean, and that's sad. That's dishonest, right? But that's the reality of our media nowadays, right? I mean, I'm going to sit here and I'm going to say what I'm going to say because I'm going to get more likes, or more people are going to look at my podcast, or I'm going to be making more money out of this. I'm going to sell more books, you know. I think that's pretty empty. I think that's sad. And I think it's totally unempathic, but that's medicine, right? I mean, that's their medicine they feel they need to feel fulfilled.
So, what do you say to those people when you have them in your office? Because I think it'd be, I would like to get to what do you say to those people, and then what do you say to somebody who is experiencing that type of pressure and the decision makers? But let's start with the people who are the critical ones.
Well, I see a lot of people who have serious narcissistic issues, that have serious issues of sensitivity to rejection and criticism, that have significant issues of depression, anxiety, and performance. And first, I have to look at the context and to help them understand the context of their situation. But the most common question that I ask people is, how do you want me to help you?
Mm.
Right? How can I help you find less destructive ways of coping with your life? Right? Um, Unfortunately, a lot of the people that I see come back and wants me to fix them. Right? And for me, is one of the most painful things to do is to tell them that I can't fix them, but I can help them reduce the intensity to a point that they're able to live their lives less destructively. Because what people need to understand is what they're doing, especially in social media, is pretty self destructive, let alone how it hurts other people. You're hurting yourself. You're not growing, you're not maturing. You're staying in very early stages of development, pointing fingers at the world and feeling sorry for yourself because somebody has more than you do or is different than you do. And the only thing you can do is throw stones at them. So that really needs to change. Now, I see a lot of people who suffer from trauma, right? Whether it's sexual trauma or physical trauma, abandonment issues, that is like the bread and butter of what we do, regardless of other psychiatric disorders. So I like the idea of letting people know that they might, they probably have done something right because they've kept themselves alive for a long time. And part of my job is to help them move from the idea of being a victim to being a survivor, and how to help them grow from the survival skills they develop, right? Because when you have been traumatized for a long time, you can only think in terms of your trauma, and your trauma becomes familiar and becomes something that you own,
That bubble
right?
of misery that
The
you've talked
bubble of
about.
mystery that we talk about a lot. So it's difficult for people to let go of the trauma because it becomes almost an identity,
Mm.
right? The trauma belongs to me and I have to suffer because of it. So making that disconnection becomes very important because you need to walk people to the steps of moving into survival, right? And there's a lot of survivors out there. Okay.
I know a
Um,
few.
yes, it's You see, we get back to some very, very basic concepts like empathy, like understanding, like context, like don't judge, right? I mean, when I sit down with my students every day, especially new students, they come in and they start seeing some of the patients I have in the hospital, and they for example, we're talking about a kid being beat up by their parents and being abused and then being abandoned, and automatically, my students will make judgment about the parents, right?
Mm,
And I'm not saying that that didn't happen, but what I'm saying is that I need more context. I will never justify a kid being abused. I'll never justify a kid being molested, right? But I need to understand the context of the kid's experience so I can help the kid. And unfortunately, I can only understand the context if I look to the whole situation, right? So it's not that we don't feel bad, but we should not judge zero. If there's something that Freud gave us, which I'm not a big Freudian person in my training, I'm more cohesion into self psychology. But something that I think Freud was very right about is about neutrality, right?
mm.
And neutrality means listen, learn, don't judge.
So instead of the snap judgments, like you said, of, oh, she's a traitor, or she's a this, she let down her country, consider the fact that this is a highly trained athlete who spent her entire lifetime working up to this point. And if she made this decision, there's probably a really good reason.
Well, yes, yeah, but independent of the good reason is her reason. And the step number one is respect her reason, right? Yes, I mean it's nice to be supported. It's nice to be understood. But at the end of the day, don't judge and respect her decision, right? I mean, I don't like to say it like this, but it's nobody's business but her. And then nowadays another criticism I'm going to make is that we're very used to feel that we have ownership of people.
Mm,
If she is representing the United States, then she's owned by the United States. And since I'm a citizen of the United States, I also own her. So if she quits, she's quitting me.
mm.
I mean, isn't that like the ultimate narcissism?
Very much so.
Yeah. Okay. So no, she doesn't belong to the United States. I hear this with politicians all the time. I mean, whenever I hear a politician saying the American people deserves, who are you talking about? I mean, I hear this a lot from congressmen. Then I think they represent like 50,000 people or something
Mm.
like that. I don't know how many 100,000 people they represent, but they don't represent the American people.
They represent their specific constituents of their
Exactly.
congressional district.
Yeah, but they're always talking about the American people. Well, the American people is not a monolith. And the American people have brains and have desires and have wants and needs, right? And that can be expressed by their votes, and they frequently are. So don't let's stop talking about the American people, because it's the same thing that is happening with the media. Is that now we talk about one thing and one judgment, and that must be followed,
Mm.
right? Versus the independence and universality of our thinking, which I think is extremely important.
So we've discussed a little bit about, or quite a bit actually, about what
Mm.
the people are criticizing. But as somebody listening in who is it does have performance anxiety, is concerned about their performance and how it reflects upon them. What advice can we give those people? What can they do to better prepare themselves?
Well, the first thing that you need to recognize is that you have it, right? If you don't recognize that you get fearful or anxious under certain circumstances, then there's nothing you can do about it, right? So you're going to try to push yourself beyond that, and you're going to start making some mistakes, and then you're going to be totally unconscious of where it's coming from. So you need to listen to your gut, right? If your gut tells you, I don't feel right, take a step back, talk to someone, uh, talk to your boss and say, maybe I need a little reassurance. Let's talk to my boss and see, I'm feeling a little insecure about this. We never want to show ourselves as being defective or failing, right? We need to establish dialogue with the people who are important in our lives so they know how we feel. We also need to, as patients, we need to listen to the opinion of other people. If somebody tells you, you look distracted, you look nervous, you're more sweaty, don't react like this a criticism, you know? I think it's okay to listen to it and not react to the comment like in the way that you have to defend yourself from attack, right? Because you're kind of proving the point, right? If you have to react with anger and frustration to something like that, number one, you're not listening. Number two, the comment made you feel insecure, right? And now you have to defend yourself. Which, once you get to that point, there's no purpose of continuing the conversation. But a lot of our lack of communication and empathy emotionally, it's behind a lot of the conflicts we have, whether it's in our personal lives or in our professional lives.
So be aware of your own feelings and reactions in response to data coming in or criticisms or even questions or conversations. But
Yes.
then what? What's the next step to
Well,
help to
then,
transcend that?
well, I'm a big supporter of meditation. I'm a big supporter of mindfulness. And I think that's become a very popular because it's very effective for anxiety, right? So you can train yourself. There's self help methods of how to learn mindfulness and how you start bringing down your levels of anxiety. But however, if it gets to the point that you're not able to help, you may want to consider seeing a therapist. You can be formally training to how to go about dealing with your anxiety. But if it gets worse, then you might want to consider taking some medications. We need to understand 40% of the population of the United States suffers from some form of anxiety.
Hmm.
That's 4 out of 10 people,
Wow.
right? And about, I would say, half of those suffer from social anxiety or performance anxiety. And social anxiety is the most unrecognized form of anxiety because it's so prevalent that we think it's normal.
Didn't we used to call it shy back in the day?
Yes, yes.
But it's more significantly more damaging than that. It's not just
Yeah, it's not just being shy or being a little avoidant. It's actually getting into a kind of fear, panic situation when you're forced into a social situation. I mean, the most traditional one was back in the day, Barbara Streisand with stage fright, right? That was like the prototypical. But there's a lot more than just stage fright. It can be as simple as having to meet new people or having to meet a new group of friends in school. That's extremely common in school, especially when you move to high school.
mm,
And that's when we start seeing the kids not wanting to go to school, right? That's different from the first grader who doesn't want a school that is having more separation anxiety from
gotcha.
the parents, right? So there's all kinds of different forms of that.
But there are therapists that specialize in this. I mean, there are sports therapy or sports psychologists and the
Oh,
like.
absolutely, absolutely. I mean,
Business psychologists and people that get people to present better. And I mean, there's all sorts of. I don't know if they're gimmicks or they're legit. You tell us.
no, no, no. They're legit, and you have people in business, people in sports who specialize in that type of population because each population has their own intricacies and your own differences, right? And they can help you a lot more than just with anxiety issues. They can help you with lifestyle. They can help you with um, how to manage rejection and criticism and all kinds of different things. So depending on the area that you're working, but the basic concepts of psychology in terms of how to help someone, I think the most helpful ones are mindfulness and cognitive behavioral therapies that don't get involved too much with the why you feel that way, but the how you go about it and how you learn new ways of coping. So that becomes important.
So being proactive, being open to new methodologies, always practicing empathy, as you said, and being as trying to be as judgmental or less
Yeah.
judgmental as possible are really the first steps for self knowledge as well as interacting with others on a more healthful manner. Is that correct?
Absolutely, absolutely. Connecting with humans in a human level, right? Not in a thinking level. And that's the problem with smart people, that smart people tend to think too much and feel too little.
Well, I think it's important to remember, again, as we started this talking about a specific person, Simone Biles, she's human and she has feelings, and she's probably more in tune with her body and her psyche than most people on this planet, being an elite athlete. So, um,
Absolutely, I'm just to finalize. I think that is somebody that we need to be proud of, but respectful of too. Right? We have to respect her choices. We have to respect her decision making. She's a survivor, and she should be very proud of that.
absolutely. Thank you very much once again for your time. Everybody listening, please share, like, and subscribe, and we'll see you again next week.
Thank you, Vince.